In 2022, 70% of NICU infants were transferred 50 to 100 miles away from home. In 2023, that percentage has risen to 93%.
My son, he was having a hard time keeping up with his breathing. They had decided that he was best to go to Akron for a specialized care in their NICU. That was extremely stressful for me. If there had been a women and children's hospital around here, I think it would have taken a lot off of the financial stress of travel and food, and I think it would have helped with the family aspect of support. I wouldn't have denied myself the medical care that I needed at the time.
Memorial's mission to the women in Southeast Ohio is the commitment is beyond anything that any organization has done for Southeast Ohio.
With a women and children's hospital at the Belpre Medical Campus, 85% of all infants transferred will remain home.
The subspecialists, the advanced higher level care, those have been a gap for that community. And to partner between Memorial Health and Akron Children's Hospital to provide some of that higher level care and keep these families close to home will change the entire dynamic of healthcare in that region.
Now, if we want higher levels of care, we have to drive a minimum of 2 hours to Morgantown, to Charleston, or Ohio State. We'll have high-risk physicians and maternal fetal medicine access locally, saving trips and still getting the top quality care that our patients expect. This way, that level of care can be provided right here at home. We anticipate not only providing care after a medical problem has been diagnosed, but actually going into educational counseling prior to any pregnancy or prior to any surgery, such that patient care can be better served in the long term. I've spent my entire career here serving the folks of the Mid-Ohio Valley, and I can't think of a better place to be. This is an amazing opportunity to be a part of this hospital from the ground up. So we anticipate this being really a boon to this area, an exciting thing to be a part of.
Oh my goodness, thank you all. This is first and foremost, let me just say thank you for coming to celebrate with us today. This is a day that promises to transform healthcare in this community for generations to come. And so I appreciate all of you all taking your time to come and celebrate that with us. And we have a lot of people to thank, like all amazing things that we accomplish. We never accomplish them alone. And so, you know, we have to get to this day, we've had a lot of help and a lot of people that are pulling together. And so, first and foremost, let me say thank you to Governor DeWine for joining us today. We really appreciate you being here. And Fran, thank you for bringing the grandkids with you. And we're thrilled to have you all here with us in Belpre, Ohio. So thank you. And Jay Edwards, I saw you, there he is. Jay, Representative Edwards was a real key to making this day happen. And so while we'll talk about that in a little bit, I'm sure, Jay Edwards, thank you for getting us to this day, and thank you for being here to celebrate with us. It is election season, and so Senator Sherrod Brown was going to be with us today, but there's a lot going on, and certainly he sends his regrets not being able to be here with us today, but we appreciated his intention to try to join us. We are joined by a lot of other folks in addition to these three that I just mentioned. To get to this point, a lot of help from both the state and the federal government. Local and regional folks, the city, the county, we've all pulled together to get here. So I want to say thank you to all of our state elected officials that are here with us today. We have many folks that are our local representatives, our mayors, our city council members are here with us. The state government has a lot of folks that have helped us, everything from the EPA, the Department of Health, all of our payer partners. So those directors many of those are here with us today. And I also have to say thank you to all the benefactors that are here today. We had a little session prior to this where we recognized some of the donors that are helping us build the success necessary to do something as transformational as a women's and children's campus. I cannot start this program without saying thank you to our partner in crime, Akron Children's Hospital. Chris Gessner is here. I know Chris is right here. Chris is my counterpart at Akron Children's, president and CEO. Thank you, Chris, for the partnership to get us here. And, finally, just in terms of thank yous and getting started, it is this community that makes this possible. And those of you who care enough about healthcare and about building a great community, whether it's our school administrators, our teachers, our students that are here with us, the future of this valley. We appreciate all of you all being here with us today as we embark on this next this next transformation for our region. And thank you for sharing this with us. About a year ago, we announced our intention to build a women's and children's campus here in partnership with Akron Children's. And we said it was going to be transformational. It would be the first ever event. This campus is is approximately $125 million that we're going to build together with our partners at Akron. And so it takes a lot of help to get us to that point. I can't express enough how important the state's support for this. I can tell you there's not a governor in the United States that cares more about kids and schools and building healthy communities than we have right here in Governor DeWine. And so we are thrilled. Governor, this will be a legacy, I think, of your leadership, that in the rural parts of the state that have never had this kind of program before, that your support, your confidence in us was what allowed us to get here today. And so I am thrilled to introduce Governor Mike DeWine to you all. Governor.
Well, what a great day. You guys ordered up the weather. Let me first give a shout out to the Belpre band. You guys want to stand up? You guys are great. All right. And how about the Parkersburg Red Wing? And they're great. Thanks for coming across the river. We appreciate it very, very much. And Marietta High School Vocal Point. We were out here just a moment ago. Thanks, guys. They did a great job. This is, as Scott said, this is really a partnership. And it's more than a partnership. We've got a lot of different people involved in this, a lot of people who, but for them, this would not have happened. But I think a partnership between Memorial and Akron Children's just makes so much sense. These two institutions, very good institutions, coming together to provide this amazing care. This is world-class care that will be provided here, right out there. And to me, it's just very, very exciting. Women and Children's Hospital, total, I think, of about $125 million. The state is putting in $30 million. That is, frankly, an unprecedented amount of money. But I want to give a real shout out to your legislators, my friend Jay Edwards, Senator Chavez, Don Jones, I saw him a moment ago, Monica Blaisdell, Justin Pizzulli, and many, many more in this whole part of the state, frankly, who came to me and said, this is something that's going to make a difference. My friend Jay Edwards, he doesn't, he's one of the more persistent guys I know of. But he's representing you, and that's a good thing. And they're all representing you, and they're all doing a great job. Thank you. Before I go any farther, I do also want to introduce my bride, Fran. We have Parker and Addie. They're from Asheville, so they've been up here with us for the last Asheville, North Carolina. They've been up with us. If you ever get to Asheville, there's a lot of fun minor league baseball team there. So, little joke, we own the team. So. Their dad and mom run the team, and Parker and Addie both worked there a lot. So anyway, they're up here with us, and we're blessed to have them for the last few days. I got to say something about my friend Nancy Hollister. Come on, Nancy, stand up. Yeah. A dear friend. I don't think I ever come to this part of the state where Nancy's not there. So we love Nancy and just appreciate, how much she has done for the whole state of Ohio, as well as in the southeastern part of the state. What this hospital represents is a major commitment by all of us to dramatically improve healthcare in Southeast Ohio. Literally, when they came to me and talked about this, I said, absolutely, we have to do this. Our goal is pretty simple, something we talk about in our administration every single day. We want every child in this state to be able to live up to their God-given potential. We don't care where they're born. We don't care who their parents are. And a lot of this, frankly, when you look at healthcare, is filling in gaps. Look, there's good healthcare here, but the specialization, as you just saw in the video, a NICU unit right here, in Belpre. And you don't really realize how important that is, I'm sure, until you have a child or a grandchild who needs to be there and needs to be there right away. This partnership with Akron Children's Hospital, they're a great children's hospital. We're blessed in this state. Some states have no children's hospitals, if you can believe that. We have a number of them, and they're all good, and they all save lives, and they all make a difference every single day. So we're very, very, very blessed. When we look at the future of the state, I'm talking about everybody being able to live up to their full potential. We know the importance of education, but we also know it's important to remove health barriers, any kind of barriers, whether it's a mental health problem, whether it's an addiction problem, whatever it is, to get help for that individual and to remove those barriers. It's also vitally important that when babies are born, much as humanly possible, they be born at a higher birth weight, that they are ready to start. We have, unfortunately, in this state, an infant mortality rate. That's kind of a nice way to say we have too many babies who are dying. And we are working every single day to change that. Dr. Vanderhoff and I met the other day with some of the folks who really deal with this around the state in regard to Medicaid, and really try to outline further things that they could do. But it's something that we worry about, we focus on, and we try to change every single day. Prenatal care is vitally important. This hospital will also be a place where moms can get that prenatal care that they need. So this is, to me, a very, very happy day. I'm looking forward to coming back when this is filled up, and we'll have another big celebration. These things don't happen without a lot of people being involved. So thank you, all of you who have been involved in this. I want to thank the doctors and the nurses and the people who are going to work in this building. They're the ones who are going to be carrying out the mission every single day. We want to provide them with the best building for them to be in and to give out that care. So a very, very happy day. I'm going to now introduce Ann Vogel, heads up EPA. Now you may say, well, why is someone from EPA here? Well, it took a lot of people. We got to get this land ready to go. So Ann, you want to come on up and tell them what you did and how, I'll tell them how important that is. Ann Vogel.
Thank you very much.
1 second, Ann. I already messed up my instructions, Governor, because before Ann speaks, I have the task of giving you this. Just to commemorate this event, we want you to have this because you were absolutely instrumental, and so we want you to have this as our appreciation.
All right. Governor, thank you so much. I'm going to follow you around more often. The Ohio EPA is not often met with a band and a choir and a dance troupe. So thank you. You guys were amazing. It is a real privilege to work for Governor Mike DeWine. He is a visionary. He gets vision. You can't spend much time around him without catching his vision for the state of Ohio. So for those of you in this tent who saw this land as a factory and knew it as a manufacturing facility with some legacy contamination and foresaw a women and children's hospital, well done. Congratulations to you. I'm here to celebrate you. I thank you for your vision. I also can't leave here without saying we want to do more of this. At the Ohio EPA, we want to work all over this region with all of you that are in this room. When there are sites that we're able to repurpose like this, let's do it together. Let's work together to see more of these projects come to fruition. Thank you for having me today. Congratulations, and I'll turn it over to you. Thanks, Scott.
So, as I mentioned earlier, Senator Sherrod Brown was planning to be with us today and couldn't because there were other scheduling conflicts. But I do want to say, this is an incredible partnership with the state of Ohio, and Ann Vogel's right. Every department of the state's been involved. We've been working with so many folks to really transform something that used to be an industrial site, and so we appreciate the partnership, Ann, and all the assistance the state's given us to turn what was once a very productive site, but now turn it into a healthcare site. So thank you. Senator Brown couldn't be here, but I did want to say it's not just a state partnership, it's also been a federal partnership. And so as we talk about $125 million, that's money Marietta Memorial doesn't actually just have sitting around. And so we're going to finance that. And Senator Brown's been instrumental in helping us work with the U.S. Department of Agriculture at a federal level so that we can make the investment more affordable for this community by keeping the rates low. And of course, as you all know, the federal government has better credit rating than Marietta Memorial does. And so it's been very helpful, and we appreciate that. I just wanted to mention that, how much we appreciate Senator Brown for his work to get us there. I have the distinct pleasure, though, of introducing one of our prominent local school superintendents. You know, this partnership between the health system and its community is always about kids, and as the governor said, removing those barriers and getting kids a better start. And so, while on the clinical side, we'll work with Akron and we'll work to make that happen. We also need a great group of schools and school superintendents and school leaders. And so it is my privilege to introduce John Hurd, who is the superintendent of Trimble Schools, And John's going to give us a few words here about the impact of this project on this region. So, John?
Well, I've been to 35 different graduations, and probably the best one I ever attended. The speaker walked up and he took an iPad and he flipped it over the end. And he said, I have 6 minutes. If the 6 minutes goes over, start flagging your hands. Well, in this instance, I have 3. So anybody out there starts waving, cut me off. As he said, I'm John Hurd, I stand before you as an educator, but as a proud child of Appalachia, a region that has shaped my life for the last 56 years. Growing up here, I learned early on the connection between our health, our education, and our community's vitality. In this beautiful but often underserved region, I've seen the struggles that families face in assessing appropriate health care. I have witnessed the impact of these challenges in our children, their dreams, their potential, and their futures. As I transitioned into education, I realized that healthcare and learning are inseparable. A child who is healthy is a child who can learn, grow, and thrive. Today, I'm more convinced than ever that we must prioritize healthcare for our children. It's not just a matter of treating illness, it's about fostering a foundation for lifelong learning and well-being. When we invest in our children's health, we invest in the hearts of our communities. We are here today dedicating this facility and highlighting the crucial connection between the healthcare facilities in rural Ohio and the future of public education, a link that Governor DeWine understands and is steadfast in supporting. When we invest in healthcare in our rural communities, we are not just improving access to medical services, we are also fostering a healthier, more vibrant environment for our children to learn and to grow. Healthy students are better learners, more engaged in their education, and more likely to succeed. By supporting rural health care facilities, Governor DeWine is helping to ensure that our children can attend schools without the barriers of illness or health-related absences. Moreover, a strong healthcare system attracts families to our rural area, creating a more stable population that benefits every school in this region. When families feel secure their healthcare options, with their healthcare options, they are more likely to settle down, invest in their children's education, and become active participants in our communities. Today is a day that stands up for that. Thank you, Governor. Ladies and gentlemen, it is my honor to introduce a dedicated public servant and champion for our community also, Ohio Representative Jay Edwards. With a steadfast commitment to include improving the lives of his constituents, Jay has consistently demonstrated his passion for leadership and progress. Since taking office, he has worked tirelessly to advocate for economic growth, supporting initiatives that create jobs and enhance opportunities for our local businesses. Jay's commitment to education is equally remarkable. He has fought for increased resources for our school, believing that every child deserves a quality education. Though his work on key legislative committees, he has been instrumental in shaping policies that support both teachers and students alike. Moreover, his advocacy for healthcare access has been vital, especially during these challenging times. Jay understands the importance of an affordable health care and has worked diligently to expand access for families in our communities in the southeastern Ohio region. Please join me in welcoming a true leader, Representative Jay Edwards, whose vision and dedication continue to make a lasting impact in Ohio.
Unlike Mr. Coach Hurd, what he didn't tell you is he coached me in high school football at Nelsonville. Now he's at Trimble. We call him a traitor at Nelsonville now because they're our big rival. But he meant a lot to me growing up. It meant a lot for you to be the one that introduced me here today. thank you for making the trip down and doing that. It means a lot. So with that being said, it's such an honor. It's funny how things work. I was thinking about this, Scott, when I pulled in here. It's funny how things work. You approached me a few years ago about this project. Who would have known that the state would have had the money to invest in this? You would have had a finance chair, from right here in this area, representing this area. And it's such an honor and a privilege to be able to be a part of this project. Obviously, the state came in at $30 million, but it's even more than that. It's not easy to it's not just handing out $30 million. You got to have a willing participant and have a great project, people that are going to follow through, and a community that comes together. I look around this room, I see people from all over the county here. When I think of Belpre, Ohio, I think a lot about Nelsonville, where I'm from. You're not much different. 100 years ago, it was very prosperous people. Not to say we've been down on our luck, but we've been down on our luck a little bit. Very blue collar people that aren't looking for a handout but a hand up, and people that just want to get things done. And as excited as I am, I'm biased. I think the governor touched on it. I'm persistent in my job, and that's what my job is to do, is to be biased to this area. The governor talked about how we're lucky. Some states doesn't have the children's hospitals that we're lucky to have in Ohio. I looked at that a little bit differently. I think every area of this state has a children's hospital. Cleveland, Columbus, Akron, Toledo area, Cincinnati area, everywhere has a children's hospital. The one area of the state that didn't have a children's hospital was right here in southeastern Ohio. That's what this facility is going to mean for our area of the state. I think that deserves a big round of applause. With that being said, we're so fortunate to have all those children's hospitals. I can't tell you, in my life, the children that have been in my life, from nieces and nephews to kids, we're so lucky that when you're in those emergency dire needs, to have a children's hospital, nationwide children's hospital, you could run to Columbus to in those times. How exciting is it now, though, especially here in Belpre? You're not going to have to go to West Virginia or some other place. You're not going to have to go to Columbus. You're going to get to come here and receive the quality of care that we need. It's such an exciting time, not to mention the jobs that are going to be created here. When I look around and see these kids wearing their football uniforms, and the band and the cheerleaders and the dance crew that's here, it's so exciting of the possibilities of these kids having an opportunity to go to school and college and come back and work right here in Belpre, Ohio. The jobs that it would create beyond just the jobs at this facility. It's such an exciting time of the economic impact. The one thing I'll say about Belpre and Washington County as a whole, you people just get it. You really do. You get it. I see people advocating for this project that had nothing to do with this project, but they owned a little business here in town. They realize that having more jobs here in Belpre means you're going to have more people shopping at the grocery store. You're going to have more people buying insurance. You're going to have more people buying cars or buying vehicles. It is a rising tide that raises all boats, and I've never seen a community get that more than Washington County gets that. So I'm going to bring up, I've got to introduce somebody, but I'm going to bring up this time my state representative that I share Washington County with, Don Jones, and we're going to ask Scott Cantley to come up because we have a commendation from the State House that we want to present to Scott. So Scott, here's a commendation from the State House. Thank you very much. And I get to introduce, speaking of football coaches, her husband coached me at Ohio University. And I see the OU president here, Dr. Gonzalez. Thanks for being here. And you might know her son on Sundays. If anybody knows some defensive players, the Bengals need some defense right now. Sorry about that. It's just my opinion. I was very mad on Sunday. But it's my pleasure to introduce a champion for children. She's been, doesn't have to, her and her husband both, they don't have to do what they're doing. They go above and beyond to make a difference in the lives of children and really families, communities, impacted people in poverty-stricken areas in southeastern Ohio and all over the state. It's my privilege here representing the Appalachian Children's Coalition today, Robin Burrow.
Just a second, steal your thunder for just a second. Jay, we couldn't have done this without you. You know, this project would have never gone forward, and you gave the governor a chance to be supportive by introducing that $30 million legislation, and you've been a gift to southeastern Ohio, and your leadership on this project will forever be a testament to the belief you had in this part of the state. Thank you for representing us so strongly, so vigorously. And it's my pleasure to present you this so you can remember as well. Thank you.
Thank you to Jay for that kind introduction, and I actually would have to concur with his statements, not about the defense, but Jay has been an absolute blessing to Southeast Ohio as our representative. And when he came into office, I feel like he is just a worker bee going. He's everywhere and anywhere. He listens to every idea. He listens to the old and the young as far as the needs that they're seeing. And so Jay, thank you very much for the introduction, and thank you for representing us well. As Jay said, my husband Jimmy is here. Give everybody a wave, Jimmy. And yes, as Jay said, we are Joe Burrow's mom and dad. Hooday. Sorry to the Browns fans and the Steelers fans in the room, but that's okay. We'll all just come together today and be friends. So in December of 2019, when Joe did his Heisman speech, he shined a spotlight on Southeast Ohio. In his Heisman speech, he started the ball rolling towards us developing and establishing his foundation. And in his speech, he specifically talked about the food insecurity here in Southeast Ohio, which was wonderful. He also talked about being a child of Southeast Ohio. And in that speech, I want all of the children in the room, young and old, well, you're not old, but you know what I mean. He said, if I can be up here, you can too. If I can be up here, you can too. His dream was to honestly win a Heisman Trophy, win a national championship, and to go on to play in the NFL. He grew up in Athens, well, actually the Plains, Ohio, a tiny little town, a little bitty school district just like all of you. And I want you to know, every single one of you, you need to find your love and your passion, your dream, and work towards it. It's not easy. Every single day you have to work to get better at whatever it is that you want to do. But you can do it. So please take that little tidbit, tuck it away in your heart, and don't forget it. So, also, as Joe's parents, we are also very privileged to be able to go to lots of different community events here in Southeast Ohio, in Cincinnati, and also in Baton Rouge, Louisiana. We have that tie, and we're very, it's a unique experience because we get to hear a lot of different perspectives. And we were at an event last week, and one of the speakers said something that really touched my heart, something that I tucked away and wanted to bring with me here today to talk to you about. And that is, a community is only as strong as its weakest child. A community is only as strong as its weakest child. So when you think about that one little sentence and think about why we are here today, we're here today to be the leaders of these communities that we live in, the leaders of these children behind us, to make a difference for them and to provide them the support that they need. As an elementary principal just down the road in Meigs County, and also as a first and a third grade teacher in Athens, I did see a huge disparity in primary care access, especially in Meigs County. And I was very lucky to be able to be one of the leaders in the district when we opened a school-based clinic. We brought in a nurse practitioner in partnership with our Hopewell Health community partner, healthcare provider, and we now have that clinic on site at Eastern Local helping our students. And I'm very excited today to officially be representing the Appalachian Children's Coalition. I am on that board as well, and the Children's Coalition has been granted from the state money to help expand primary care school-based clinics in Appalachia. There will be an additional 35. We keep going up. It started at 28, now we're up to 35. School-based primary care clinics, which is wonderful. Children at schools will be able to have access to primary care right there on their school campuses. I know Trimble is one of those schools that's had a primary care clinic for a while. Unfortunately, though, up until today, as we sit here to celebrate this wonderful groundbreaking, the access to specialized care has been a huge gap. And so now, as we stand here today to celebrate this, it is a wonderful and amazing, much needed facility that will be here right here in Belpre to provide that specialized care that otherwise we would be driving, as many people have said, several hours to gain that access. As an educator and a school teacher, I saw firsthand every day how the lack of access to specialized care was a huge disparity for our children. Between the hours of traveling to that specialized care, to students being untreated because their parents couldn't make that trip, to families who had to pick and choose that time and that money to make that trip or lose work hours. Those are all things that we all know living here in this community are a huge problem. So, and all of those things also really lead to excessive absences for children at school. And when children are not at school, they're not learning. That just deepens and widens the gap for our children to be able to be successful here in Southeast Ohio. So I'm very humbled, I'm very honored, and I'm enormously excited to stand here with you today to celebrate this groundbreaking for the Women and Children's Hospital. Thank you to everyone in the room for being committed to this initiative, and to all of you who help our communities to be stronger for all of our weak children so that they can be stronger for our future. Thank you.
Thank you, Robin. Appreciate it. We are blessed with a lot of leadership at many levels, and honored to introduce Brian Chavez to you. Brian's our state senator, and we are pleased to have his leadership representing Washington County, in addition to other counties in Columbus. So Brian, thank you for being here.
I am Brian Chavez, represent the 30th Senate District, and I'm the new guy here, so I have to keep repeating who I am. So I was appointed in December. As I'm thinking about it, I want to, at the end of my tenure in the Senate, I want to be as well respected, well regarded, and well thought of as Representative Edwards and Representative Jones. That is a lofty goal to achieve, and I've been working very hard to do that. I have a very large Senate district, so I'm all the way around that. So this is much too important of an event for me to ad lib. So I'm going to go ahead and read this, what I prepared here. And I think that I printed it up too big because a lot of my topics Mrs. Burrow already covered. So I just want to take a brief moment to draw a personal parallel to this initiative. With permission of my wonderful wife, Christy, who's sitting over here in the audience, I wanted to share with you that both of our children were considered high-risk pregnancies. That meant that additional and frequent monitoring were required throughout the pregnancy, and especially towards the end, where it became really frequent. We lived in a larger city at the time and had the ability to attend the 20 to 30 minute meeting, 20 to 30 minute doctor's appointments through about an hour's worth of commitment at our time. In areas like this, prior to this initiative, that same 20 to 30 minute appointment will require half a day's worth of commitment and probably most of a tank of gas to drive up to Akron and back. Unfortunately, it's sometimes easy to make a decision to forego that treatment if you can't make that commitment, and that could lead to complications for the mother and the baby, and those complications could last a lifetime. So a robust healthcare system is needed in strong communities like ours. This facility is a wonderful investment in the future of Southeast Ohio and the Ohio River Valley. So it's my great privilege to offer this letter of accommodation for this event. Now, I don't have it framed. I think the representatives, there was two of them, they teamed up on me, but I don't have it framed. So, Mr. Cantley, if you'd like to come up here.
Here, let me also introduce a gentleman I have the privilege of working with closely on a lot of issues. Kevin Ritter is a Washington County Commissioner, and we work really closely with our county on a lot of issues, certainly a lot of health issues, a lot of things to improve the quality of life in our county. Kevin's been an incredible leader, and I am looking forward to working with Kevin as he transitions to what I hope to be his next role as our state representative. So Kevin, it's my pleasure to introduce Kevin Ritter.
Wow, what a crowd. Governor DeWine, Mrs. DeWine, Representatives Edwards and Jones, and to all our other special guests, good afternoon. I'm County Commissioner Kevin Ritter, and I'm honored to be here on this very special occasion. I want to thank those with whom I share the stage for making this project a reality. My greatest passions are utilizing our region's resources for economic development and educating our youth. But neither of these is possible without a solid foundation of a healthy population, especially healthy mothers and healthy children. For decades, our region of the state has struggled to reverse negative trend lines. The data speaks for itself. When you pull up a map of Ohio, the southeast region often ranks near the bottom. Near the bottom in troubling indicators like infant mortality, neonatal substance abuse, low birth weight, and other unhealthy conditions that harm our overall regional growth potential. But because of the efforts of those who are here today, and because of the innate characteristics and conviction of those who live here, Southeast Ohio is on the rise. We're turning things around. And in the years to come, I expect our part of the state to be a leader in innovation and in development. Today, we see what effective government can accomplish. Today, Scott Cantley, Dr. Brees, and the team at Memorial Health Systems have shown us what effective leadership in the private sector can accomplish for our rural communities. They've shown a commitment to ensuring the rural residents of Southeast Ohio will have the same access to quality health care that citizens currently enjoy only in our urban centers. On behalf of my fellow Washington County commissioners and all the local elected officials here today, and on behalf of the citizens who will experience a better quality of life thanks to this project, I want to say a heartfelt thank you.
Well, Kevin mentioned the next person a couple I want to introduce. I've had the privilege of working with a lot of really great people. Been blessed to be surrounded by talented, caring professionals, nurses, doctors, technicians, and a lot of other support staff. But yeah, in my career, I've never been blessed more than to introduce the next speaker, Dr. Dan Brees, my partner in all things planning at the hospital and making sure we take great care of this community and in trying to build a better future for this community. I know you weren't born here. You grew up in Huntington. Dan and Leah came from the Huntington area, but they have certainly adopted the Mid-Ohio Valley and work tirelessly every day to make this a better place. And you've been raising a lot of money. And so I want to introduce Dan and Leah Brees.
All right, well, thank you, Mr. Cantley. Leah and I were asked to be co-chairs of the campaign steering committee. This is quite an honor, and for you, Mr. Cantley, I thank you for that, as well as our board of trustees. Many of them are in the audience today. It was an easy decision for us to accept that offer, and I'll tell you why. As Mr. Cantley said, we have been here 15 years in the Mid-Ohio Valley. We have two wonderful and beautiful children that have been here 15 years with us as well, and they've needed health care. Leah's parents actually moved up, she's one of one, but moved up here from the Huntington area years ago, and they are committed to the Mid-Ohio Valley. So we are as rooted into this community as you can be. It also gave us a chance to work together. So far, so good, right? All right. But we know what it means to bring world-class healthcare to this community. You all expect it, and you deserve it. You deserve the very best healthcare that you can possibly get anywhere else in the world right here at home. There's no question about it. And that's what we're going to do. So we are in charge of the campaign steering committee. So as Scott alluded to, we are tracking all the money and deeply rooted into the foundation. But we can't do it alone. So we have a few steering committee members that are here in the audience. And let me tell you, before I introduce them, I just want them to raise their hand as I do so, and then we can acknowledge them at the end. But the reality is these four folks that have joined the committee have made a personal commitment of a minimum of $50,000 as well. So they know the importance of bringing this level of healthcare to this community. So I'll go ahead and name them. Chris Hall, you'd raise your hand right here in the front row. All right. Steve Kaiser, raise your hand for me right here. All right. Dr. Bob Banke, over this way. Okay, very good. And we have a fourth who couldn't be with us here today, Colleen Cook. Many of you know her. She would be nowhere else unless there was some reason she couldn't be here today. She has been a foundation member of the Board of Trustees for the foundation for over 40 years. So we're lucky to have her as well as part of our campaign steering committee. So today we want to talk a little bit about the campaign, and I'll try to keep this as brief as I can. The Together campaign, before we publicly launch it here in just a minute, is made up of 3 different focuses. One is bringing the Women's and Children's Hospital and Center right here to this campus. That's the first focus of it. The second is to grow the endowment fund, which will ensure that we can bring other great healthcare projects to this community for years to come. And the third is to raise money and grow our Memorial Health Fund, which really focuses on what patients needs each and every day so they can receive the care right here in the community, and we can help them address those needs and make sure that they get to their appointments, et cetera. So those are our 3 focuses. So without further ado, if I can get a drum roll, please. Oh, we got lots of people doing it. I like it. We are now going to publicly launch the Together campaign. I know. Paige Smith is looking at me going, pyrotechnics, really? No, these are cold fireworks. We had it checked out. The governor said it was okay, I think. So let me tell you just a brief couple minutes about the campaign. This is really the most ambitious campaign that we've ever had. It's $50 million that we need to raise. But I'm proud to tell you, we have already raised $37 million. That leaves us with about $13 million that we need to raise by the end of December in 2027. We can do it, and we can do it together. This momentum was set forth for us last year, and it is going strong to this day. And I'm just going to mention a few of the gifts. We had a VIP donor lunch that happened right before this, and we highlighted a lot of gifts. But what kickstarted us back in 2023, I'm just going to note a few of these. So if I miss anybody, you're not forgotten. I promise we're going to roll them on the screen here to my right, the donors as well. But we had a $2.5 million donation from People's Bank. We also had a $1 million gift from the Hall Financial Group and Chris Hall. And a $1 million donation as well from the Dave and Arlene Archer family. There are so many other countless gifts of individual donors, corporations, and area foundations that we highlighted previously. We can't do it without them. So I'll bring us back to that $13 million number. It's $13 million. We can do this. I challenge everyone here, as well as those that you know, to look at your own philanthropy and those around you, and we can do this together. Just like the name of the campaign, the Together campaign, we can all bring this world-class healthcare for years to come right here on our campus, but we can only do it together. So thank you very much.
So not just a talented ER physician, but he can do math well. And that's really impressive. Thank you, Dr. Breeze. I mentioned the federal partnership. We're celebrating so much of this has come from the state and the leaders that we have here today, and I appreciate that. But I also want to acknowledge our representative, Mike Ruley, who took his time today to come visit us. Mike, I'm going to find lots of opportunities to ask you to help us as we are on this journey, because there are many things we can do together. But thank you for being with us today, and we appreciate your leadership as well. Proclamation from the House of Representatives from the United States. Thank you. Thank you, Mike. Appreciate it. So I got the honor of unveiling the new look of this campus, Governor DeWine. Our architects, we've worked with some really great architects, both at some folks that have traditionally been partners at Akron Children's, and we've worked with a group of really talented architects. I see Mark Mullen, one of our lead architects here today. we've worked with some really great folks that have worked all over the world, that have expertise in healthcare. And we think we're designing something that is incredibly impactful, but also very specific to Appalachia and who we are. And so when we had this opportunity to build a women's and children's hospital, it was an opportunity to really bring something that will enhance this whole southeastern Ohio. And so, Mark, it's my pleasure to unveil some of your good work. Mark, I don't know if you want to at least raise your hand so people can come up and pat you on the back in a little bit. It's a thing of beauty, and so if I can unveil this rendering so you can see the new Women's and Children's Hospital. But we're building both a hospital, and I think as so many as Robin, as you mentioned, and so many folks have mentioned, access to subspecialty pediatric care. We have great pediatricians, many of whom have trained up at Akron, but all over the country. And we have so many great folks, but getting access to subspecialty pediatrics and really reinvesting and doubling down on this region deserves great things. And when I look around this room and I see leaders from not just from the state and from the political leaders, but I see community leaders. I see Tyler Wilcox from People's Bank, and I say, oh my gosh, these are people that believe in this community and believe we should have good things. And just because we're rural doesn't mean we can't. If we do it right and we work with the right partners, we can do really great things. And I know there's a lot of worry today that rural parts of the country are really struggling, and we're having a hard time finding a path forward. But with partnerships like we have here, with this community, with the people that believe in healthcare in this community, and those of you who have supported our campaigns or will support our campaigns to really build a better healthcare system right here in our hometown and right here for this region, we are going to really make a difference. And so this is a groundbreaking ceremony, and it is my privilege to say, let's move over and move some dirt, Governor DeWine.